Many people notice an unexpected change sometime after the age of 40. They begin needing the bathroom more often than they used to. During the day, they may find themselves making more frequent trips to the restroom. At night, they may wake up once or even twice to urinate, something that rarely happened in earlier years. At first, this change may feel confusing or even slightly concerning. Some people worry that it means something is wrong with their health, but in many cases, this shift is actually related to natural changes that occur in the body during midlife. To understand why this happens, it helps to understand how the bladder works. The bladder is a muscular organ whose job is to store urine until the body decides it's time to release it. When the bladder fills, stretch receptors send signals to the brain indicating that it is time to urinate. In younger adults, the bladder is able to store larger amounts of fluid before those signals become strong. However, as the body ages, the bladder can gradually become more sensitive. This means the signals to urinate may be triggered earlier than before. The bladder may not actually be full, but the brain begins receiving the message that it is time to go. Another factor involves the muscles that support the bladder. The pelvic floor muscles help control urination by supporting the bladder and the urethra. These muscles can gradually weaken over time, especially if they are not actively exercised. Pregnancy, childbirth, chronic coughing, and prolonged sitting can also contribute to weakening of these muscles. When the pelvic floor becomes weaker, the bladder may feel less supported, and signals to urinate may occur more frequently. Hormonal changes also play a role. Hormones influence many systems throughout the body, including the urinary system. For women, changes in estrogen levels during perimenopause and menopause can influence the tissue surrounding the bladder and urethra. These tissues may become thinner and more sensitive, which can contribute to increased urgency or frequency. For men, gradual changes in the prostate gland may influence urination patterns. The prostate surrounds part of the urethra, and as it slowly enlarges with age, it can influence how urine flows from the bladder. Another factor involves sleep patterns. Many adults experience lighter sleep after 40. When sleep becomes lighter, the brain may become more aware of signals from the bladder during the night. In earlier years, those signals might not have been strong enough to wake someone up, but lighter sleep makes nighttime awakenings more likely. Hydration habits can also influence urination frequency. Many people begin drinking more water as they focus on improving their health during midlife. While proper hydration is extremely important, consuming large amount of fluid late in the evening can increase nighttime urination. Certain beverages can also irritate the bladder. Caffeine and alcohol are known to stimulate urine production and increase bladder sensitivity. Coffee, tea, soda, and energy drinks can therefore make bathroom trips more frequent. Stress and anxiety can also influence bladder activity. The nervous system and the bladder communicate closely, and when the body experiences stress, the bladder may become more reactive. This is why some people notice increased urgency during stressful periods. All of these factors combine to explain why bathroom frequency often increases after 40. Although more frequent urination after 40 is common, there are several habits that can help maintain a healthy bladder and reduce unnecessary trips to the bathroom. One of the most effective strategies is strengthening the pelvic floor muscles. These muscles act like a supportive hammock beneath the bladder. When they are strong, they help maintain proper bladder control. Pelvic floor exercises, often called Kegel exercises, involve tightening and relaxing these muscles repeatedly to build strength. With consistent practice, these exercises can improve bladder control and reduce urgency. Another helpful strategy involves managing fluid timing. Hydration is important throughout the day, but consuming large amount of fluid shortly before bedtime can increase nighttime urination. Many health experts recommend gradually reducing fluid intake during the 2 hours before sleep while maintaining proper hydration earlier in the day. This simple adjustment can significantly reduce nighttime bathroom trips. Limiting bladder irritants can also help. Caffeine stimulates the bladder and increases urine production. Reducing caffeine intake, particularly in the afternoon and evening, may decrease bladder sensitivity. Alcohol can have a similar effect, so moderating alcohol consumption can also support healthier bladder patterns. Maintaining a healthy weight can further support bladder health. Excess body weight increases pressure on the bladder and pelvic floor muscles. Over time, this pressure can contribute to increased urgency or leakage. Regular physical activity and balanced nutrition can help reduce this pressure and support overall urinary health. Physical activity also improves circulation and supports healthy nerve function. Walking, swimming, and light strength training can all contribute to better bladder control by supporting muscle health and metabolic balance. Managing stress is another important factor. Because the bladder is closely connected to the nervous system, high stress levels can increase urgency and frequency. Relaxation techniques, such as deep breathing, meditation, and mindfulness exercises, can calm the nervous system and reduce stress-related bladder sensitivity. Improving sleep quality can also help reduce nighttime awakenings. Maintaining consistent sleep schedules, reducing evening screen exposure, and creating a comfortable sleep environment can support deeper sleep. When sleep becomes more restorative, the brain is less likely to awaken in response to minor bladder signals during the night. It is also helpful to understand when bladder changes might require medical attention. If urination becomes painful, if blood appears in the urine, or if urgency becomes severe, medical evaluation is important. However, in many cases, the changes that occur after 40 are simply part of the body's natural aging process. By strengthening supportive muscles, adjusting fluid habits, and maintaining healthy lifestyle patterns, many people can keep their bladder functioning comfortably and efficiently for many years. The body remains adaptable throughout life, and even small adjustments in daily habits can significantly improve bladder health and overall comfort.